What does a typical day for a foundation doctor working in general practice involve?
You'll be split into a morning and afternoon clinic, and in the morning you might see between 6 to 10 patients depending on workload, and then in the afternoon you might see between 4 to 8 patients depending on workload. And that could be a mixture. Some of them are telephone consultations, some of them are face-to-face. A lot of the time it's kind of up to you how you want to see the patient, depending on if you feel like it's something you need to see them for. So you'd usually spend about 3 hours running morning clinic, and then you'd have lunch, and there's this big gap, usually about 2 hours or so. So you might take an hour for lunch, and then in the other hour you can catch up on notes from the morning clinic. In my practice, I also would review patients' clinic letters and their discharge letters just to see if there's any actions that I need to follow up on. And then in the afternoon, you would carry on with your clinic, seeing patients. Tends to be shorter, which is quite nice. And then typically you might finish an hour before in terms of how the patients are booked in, and that gives you time to then catch up on things again before you then leave. And it's usually about an 8-hour day. So